fact that tonight, we are talking about sexual abuse as a hot topic. This may sound strange, but I think it's fantastic. Why? Because 50 years ago, in 1972, it's my year of birth, the psychologists back then, 50 years ago, and also psychiatrists were learning in the books that incest, so sexual abuse within the families, happened to 1 in 1.1 million women. So in fact, the books were saying that incest is very, very rare. And it also said in the books 50 years ago that the impact of incest was minimal, neglectable. Now, we know so much more now in 50 years of time. We have learned about the size of sexual abuse, all different types of sexual abuse, and the impact on the body and the soul. And we know now that actually the numbers are very high, especially children are most often victimized. And although most people think that it's the stranger rape, and parents still tell their children, don't open the door, don't go with strangers, don't take candy. The fact is, the reality is that most sexual abuse happens 85% by someone that you know very well, because there is a bond and there's often also a positive relationship, trust, and there you cannot abuse a child without the child trusting you in a way. Now, what happened also along the time that we don't only have sexual abuse like hands-on, but we also have different types of sexual abuse online through the internet. For children, for example, children and adults who are being forced to do sexual acts with themselves, or to make an appointment in real life and then are being abused. So this is, at least in the Netherlands, a very big problem, and it's called by the police the national threat. Because instead of the sexual abuse numbers going down, they're going up. And whether you are abused in real life or online, the psychological impact is the same. Now, I often also tell, when I have the opportunity to tell people who don't want to hear about sexual abuse, I always say that the inconvenient truth is that anyone can be victimized by sexual abuse. Anyone, any child, any adult. But there are some risk factors, such as being female, a lower intelligence level, the use of alcohol, drugs, living in a children's home, for example. But the most robust risk factor for sexual abuse is prior sexual abuse. And it's a very sad truth that 50% of the children that have been sexually abused will be abused again as an adolescent or in adulthood if they don't manage to process what happened to them. So this is a very big problem, re-victimization. So you have a repeat of sexual abuse or sexual assault, online, offline, hands-on, hands-off. But you can understand that every time when this person is being abused again, the impact of the first abuse will only increase. And it's for some people very difficult to understand, how does this work, this cycle of re-victimization? Why, if you have been abused once, why would you be at risk to be abused again? Well, one of the explanations is that the consequence of the first sexual abuse, for example, post-traumatic stress disorder, with a very significant symptom in the avoidance cluster, the emotional numbness. So while you were being abused by your brother or the neighbor, you protected yourself by cutting yourself off from your senses, and which is good at the moment, but later on you go on into your life without this sense, without this intuition, or without a compass. And that's very difficult and dangerous, because risky situations cannot be detected in time, or you cannot feel it. And another explanation is, when you are being abused as a child, most children do not think, oh, the perpetrator is a bad person. No, they think, I am a bad person. There's something wrong with me. I am bad. I am filthy. There's something definitely wrong with me. And this wrong conclusion about themselves is, in my opinion, the main source for later problems. Now, do you see this image of the three monkeys? You do. I think it's a very good metaphor for understanding the dynamics of sexual abuse. Because if we go to the right, it's the monkey that's silent. This monkey represents the victim or the survivor. I'd rather speak of survivor, because I think people who have survived sexual abuse for years are very strong, and I don't look at them from my perspective as weak. I think they're very strong. But for this image, let me use the word that is most often used. So the monkey on the right side represents the victim. And that monkey knows, I should not speak. It's better if I don't speak. Something terrible will happen if I speak. Or the monkey on the right just tells himself, it didn't happen, it didn't happen, it didn't happen, it didn't happen. It's just a dream. And it's a way of protecting yourself and living a double life. Because all children that are being abused by someone they know very well have this impossible task of having a normal life, and at the same time have this abuse life, which is top secret, and they know it's my duty to protect this secret. Some children do even more effort to protect the secret than the perpetrator himself. Now, the person in the middle would represent the perpetrator, which is most often a man, but in case of child sexual abuse, in 7% of the cases, the perpetrator is a woman. But to make it more clear, I will talk about he and him. The perpetrator is closing the eyes because he does not want to confront himself with his own behavior. And the perpetrator, in a way, is doing the same as the victim in terms of, it didn't happen, it's not that bad, it's okay, she came towards me, she wouldn't come to me, this is special, I love her, this is real. And the child, the perpetrator knows that he is doing something that is a crime. He can end up in jail. Every perpetrator, well, almost every perpetrator knows that. And from my experience, there are two types of perpetrators. The one that know this is not allowed, but I want to do it anyway. And how can I do it without being caught? And there's this other type of perpetrator who, in a way, never thought about having sex with a child, but due to circumstances, and this is not an excuse, but due to circumstances, isolation, without work, trauma from before coming up, loss, and trying to find intimacy with a child, and from intimacy, it develops in a sexual contact. Now, the perpetrator knows that this is not okay. But what he tries to do is make the child feel responsible for the sex and for the consequences if it comes out. Because the perpetrator will think, if the child feels, if we are into this together, the risk of a disclosure will decrease. And the perpetrator can do this in different ways. It can be in a very direct and very, very rough way. If you tell, I will kill you. If you tell, I will kill your sister. If you tell, mommy and daddy will separate. If you tell, grandma will have a heart attack. If you tell, I will go to jail. If you tell, I will kill myself. If you tell, you will go to jail. If you tell, you will go to a foster home. If you tell, nobody will believe you. And everybody will think you are a filthy, dirty child. Now that is the rough way, but there are also more subtle ways. And some perpetrators really believe this. They really feel it like, I love you, this is real love, this is something between you and me. Nobody will understand this. I am the only person who understands you. You are the only person who understands me. I cannot live without you, etc., etc. Or, hey, you came to me. You started this. If you don't want to come to me, that's okay, but you are coming back to me all the time. Do you feel what's happening within the child? Because it's true. And most often, unfortunately, chronic sexual abuse goes along with with neglect. So children who, there's a hole, an affective hole at home, something is missing at home, and these children, of course, are longing to be wanted. Every person wants to be wanted. I want to be wanted as well. So a child is longing for it, and there's this person giving it. I see you, child, but there's also the part with the sexual abuse, and that is the wrong part. And then on the left side, that is the rest. That is the society. That is professionals who, in a way, don't want to hear about it. Please, not in my backyard. This is not happening in my street. This is not happening in my football club. This is not happening in my school, in my family. But in fact, sexual abuse, it's not nice to say, but it's very close to us. It's being done by people that we know very well. It's our friends and our family. And the perpetrator will do anything, even use the genital response of children, like boys get an erection or girls having a lubrication, like, hey, you wanted this. So it's not so strange that boys, even more than girls, don't speak up. They are very ashamed of how their body reacted. The thing is that every person, every boy who is in serious stress condition will have an activation of the stress system, blood going to your hands and to your legs, and also going to your genitals. It has nothing to do with consent or sex. It has to do with activation of the stress system. Boys have it too when they have to do a presentation in school, or when they make a goal with football, or when they do something wrong and they get punished. So it's very important that we explain to people what normal reactions are during sexual abuse, which is the genital response, but also doing nothing or cooperating is a very normal response from people, from children, when they have to survive sexual abuse. Later on, when they grow up, then they start thinking, why? Why did I do that? Why did I go alone? Why did I go to this person? Why did I go into the car? So I think the reason why people have sexual abuse victims have so much problems is because they are blaming themselves all the time. And look at this. So they blame themselves, the perpetrators blame them, and the rest blames them. Now, find the escape for yourself, which is really difficult. So why do society does that? Why do they engage in victim blaming? Why, when people disclose, if I would tell you, somebody broke into my home, someone came into my house and took along my wallet, all of you, that's normal. People say, oh, that should never have happened. Oh, come here. Can I bring you coffee? And everything will be okay. And I will get a normal social support response, which will help me in processing this, because processing trauma is a social process. We don't do that on our own. Now, what if I would tell you someone broke into my body? Because that is what rape is about. It's a breaking into someone's body without asking, you just come in, without knocking the door. Now, when people tell, oh, you know what happened to me? Last night, somebody broke into my body. They will get a total different response. A high variety. I will give you some. Of course, you know, why did you open the door? Why did you meet that person? Why didn't you fight? Why didn't you scream? Why didn't you bite? And then along the way, when it's longer time ago, oh, well, I mean, he didn't really rape you. It was just assault. Why are you telling me this now? Why didn't you tell me this before? Why didn't you report to the police? Why aren't you doing more effort in your therapy? Don't you think it's over now? This has been so long ago now. Is it really that bad? Oh, there's always something with you, and so on and so on. You will not believe, I've done some research on this, what people are telling to people who disclose. So I perfectly understand why people do not disclose, because it can cost you more. It can bring you back, and the knife that you push into your own back, it will just give you an extra knife, and nobody is waiting for that. So yes, we should stop victim blaming, and it's a societal problem because we all think it cannot happen to us. And it's even worse with parents who have a child that has been abused. Other parents, how they talk. Oh, no, that would never happen to my child. Oh, my child would immediately come up to me and tell everything. Oh, I would see, I would know, I know my child. And I can tell you from experience and studies that children who are being abused are doing their utter best not to be discovered. And even in families where they're warm and they talk about sexual abuse and they talk about sexuality, and they're open, and in fact, it can happen to anyone. It can happen to me as well. Every time when I say that, I feel it because it's the truth. It can happen to me and my children as well. So what I wanted to say that these parents are not bad parents. You are not guilty for not seeing, because it was not meant to be discovered. Now we know when we follow children in time into adulthood, it's a serious risk to become very ill, physically and mentally. So this is not a nice story. This is a very serious story about depressions, anxiety disorders, suicidal ideation, and dependence problems. And a lot of times they are comorbid, so they exist alone. And PTSD, post-traumatic stress disorder, often is there. Sometimes people get used to avoiding certain sensitive things. They become used to having nightmares. They become used to having problems with concentration and sleeping. And I think it's sad, because I really think we should do everything as mental health professionals to help diminish the problems of post-traumatic stress disorder, because it's really ruining your life. And very often going with, for example, with comorbid depressive disorder or comorbid borderline personality disorder. And of course, their worst enemy is their memory. Luckily, we do have these treatment options. Yay, that's the only good part of my presentation. There is something to be done. It's not 100% guarantee, but any person, at least I think, should be offered treatment or should be helped how to get into contact, to at least try, or at least do one session as an experiment, and to get the trust and the courage to proceed. What I want to finalize with is, when it was the COVID period, I have done some webinars for people, adult people who have been abused as a child. Because I was doing webinars like now, but then I thought, why am I not doing webinars for people who have survived all this and are still suffering with the aftermath? So the format was like this. All these people could just join in anonymously, and they could all send me questions before. And then I would answer the questions together with another victim of sexual abuse, and I would be there as a researcher. What do we know from research? So all these questions were being answered from different perspectives: science, practice, and own experience. And what I learned from these webinars is that, of course, PTSD is very much life-ruining, and we should do what we can do to reduce these problems. But no, and there are so many questions that these people have that have nothing to do with PTSD, have nothing to do with depression. Well, yes, in a way, but are more like human questions about their life and about the relationship with themselves and with others, with important others. So just to show you some of these questions and why it is important to treat PTSD is about quality of life and the risk for development of comorbid disorders, but also the risk for re-victimization. So let me stress that again. If someone has PTSD, please try to reduce it, because in a way it's waiting for a new type of sexual abuse. Now, here are these life questions that I want to finish up with. This question came along very often. Why me? Why me? Why did he choose me? How come I still feel guilty? Should I tell my partner? Should I tell my children? How should I tell my children? Is it normal to hate myself? Is it normal to hate my body? Will my life ever become normal? Will I become a perpetrator? Why do I lubricate when I remember the abuser? How can I trust others? I know I was abused, but I have no memories. Why do I feel so lonely? Can this happen to my children as well? And so on and so on. We received hundreds of them, and it eventually led me to the decision to write a book and answer all these questions from different perspectives. And this book will be ready at the end of the year, because I think for me it was eye-opening. So, I'm all the time concentrating on this PTSD, but there are more questions that are at different times in your life can come back. Maybe not when you were a teenager, but hey, these questions can come up when you have children yourselves, or when you are pregnant, or when something terrible happens, like the war now. I wouldn't be surprised that there's a number of people in Ukraine who have new problems connected to the sexual abuse in childhood because of the war. And I think this is the way how we should look. This should be, I think, our perspective on sexual abuse. I do not necessarily believe that it can have a lifelong impact in terms of lifelong prison as a person. I do think you can free yourself, and there's always something to be done. There's always something to be changed into the positive, but it can change along the way. It's like that with trauma in general, but with sexual trauma, I think specifically, because when you become older and when you learn more about the body, about sexuality, about what is normal and what is not normal within, for example, families, and you read more and you hear more, when you grow up, these memories change, and they will have a different label and can have different emotional value. So even if I have someone in treatment at the age of 16 and the treatment was fantastic, it doesn't mean, it's not strange that in 5 years this person can come back with new problems. And I think if we are honest, it's very honest, I think, to tell this 16-year-old and the parents, listen, this is what happened to you. It was not your fault. There was nothing wrong with you. But it did something with you. Something changed within you. And it is possible, not necessarily, it is possible that when you grow up, your memories can change, not in terms of the content, but the meaning of it and the emotional value. And I'm very much a fan, positive about construction. I think it would be normal to have every year a checkup. Have people come back. For example, children 10 years old, come back 1 year later. Okay, you're now 11 years old. How do you think about back now? Do you think, would you like to go to the police now? Would you like to see a doctor now? No? That's okay. Maybe next year. See you next year. And then you can do a follow-up, which is, if we look at the literature and we know how the impact is, why don't we have this system? I'm working in a children's hospital. Every children here who have cancer or diabetes, they come back every year. We have a monitoring system every year. It's totally normal. Why don't we do that with sexual abuse? And this is the image I will end up with because I like it so much. Yes, sexual abuse can leave scars, but it was not your fault, and it's totally okay to show it. That's okay. So I want to end up with this slide. And my apologies if I exceeded the time, which I did. I'm sorry.
No, thank you, Iva, for a passionate, compelling talk on a very, very, as you outlined in the first couple of, very prevalent issue. I'm sure that this will resonate with the audience, and maybe we can have maybe one or two or three questions. And the way that the audience can participate doing so is by just raising your hand, by pressing the reaction button, and then we'll see a hand. And you can also go to the chat, but it would be nicer if you use the hand button so that we can give you the opportunity to express your voice and we can see it on the screen. Now, just if I may, Iva, to just start with one question. and I'm not so much hesitant to ask it, but yes, there are treatment options that you outlined very carefully, and we learn about quick fixes or so. It seems as if what you're saying is like there's not a quick fix, like 6 EMDR sessions or 12 EMDR sessions. What is your experience in helping or treating people who do come out and who actually try to go, have sort of overcame their shame? They meet you. You go through these systems, but what is your experience on the,
Yeah.
let's say, prognosis of
Yes.
how they go in time?
So what I do with when children come, I see them between the age of 6 and 25. So usually they have these images in their head. It can be flashbacks, or it can be images of things in the future. He will catch me, he will come out of prison and then take me and kidnap me. Most often these kind of flash forwards. And EMDR therapy works well because if you can at least reduce the emotional tension going along with these memories, then it's easier to talk about it, and it's easier to draw about it, and it's easier. Often I make a book with different chapters. So yes, it's very helpful, but it's not enough. I think it's not fair if you have been abused by your neighbor for 6 years and really have the feeling that you might die, because that was he was threatening. If you tell, I will find you. It's not realistic to think that that is enough. I mean, because being forced to live a double life, I mean, that is even for an adult who is, for example, cheating a partner, already quite difficult to do. Now, imagine you are 8 years old and being forced to have this double life. So it's going so much deeper. And especially what I told you in the first 5 minutes, the wrong conclusion that children draw about themselves. That is, there is something wrong with me. That is all the time. That is the main cause, I think, because the sexual abuse, if you look at what people are suffering from, depression and anxieties, it's not the result of the sexual act itself. It doesn't matter, I think, were you abused 6 times or 8 times or from the front or from the back. The reason why people get stuck is because they, from hindsight, they really think it was all my fault. I could have stopped this. I could have, if I wouldn't have done this or that. And this self-blame, together with there's something totally wrong with me, this combination can be fatal. And yes, you can do work with EMDR, yes. But it's unfair, I think, to think that that is enough.
Thank you, Iva. Thank you. I'd like to entertain 2 questions, and one is by somebody who's raised her hand, but I also invite, since he's with us, Oleg Shaban, if I may invite you second to maybe give a comment or a brief response if you wish. I would just give the floor to Ulrike Schmidt to raise her question. Uli, if you want.
Yes, thank you. Thank you for the excellent talk. And I just want to briefly comment, you're fully right. The belief of the victims that they have done something wrong is central to the whole disorder, and it lasts the whole life through in many cases. So I'm working with sexually traumatized persons every day, And exactly what you said, I see and hear every day. And this should be addressed in the psychotherapeutic treatment. This is a core point.
Thank you. Thank you.
Thank you for underscoring that, Uli. I don't want to put you on the spot, Oleg, by inviting you, but since we're all glad that you're joining these sessions every time, and maybe with your reflection or some comments, if you would be so kind.
Дякую, Ерік.
Thank you,
Дякую,
Eric.
Іва.
Thank you, Eva.
Коли я слухав чудову
As I was listening to this outstanding lecture by Eva, you know, it's so heartfelt. And I remember what our Chinese colleagues were writing at the outbreak of COVID-19 epidemic, not pandemic, but epidemic. They were writing that 5-6-year-old children were suffering because of this magic thinking that the children are to blame for the parents' illness, allegedly. I think, Eva, you touched upon a global topic of this raised helplessness. It's often cultivated within the families, and this forced helplessness triggers major depression in children. We Ukrainian are seeing this interesting phenomena of collective trauma. This collective trauma has a lot of sexual violence in it, has a lot of individual trauma in it. There's yet another topic. Perhaps it's something we need to elaborate in the future. In the context of sexual violence, this is secondary traumatization. Those who are listening to all those accounts. In the end of May this year, the ombudsperson was changed. It's a very high ranked official, and the journalists accused this a politician, because this post was held by a politician, and they accused her of providing too detailed accounts of sexual violence committed by Russian soldiers against children. The ombudsman was sitting down for an interview, and she also mentioned that the soldiers abused a baby, and this caused a huge public outrage. I think it's also the responsibility of the person who informed. I started with collective trauma, not individual trauma. Also the responsibility for a person who disseminates this kind of information, and this creates yet another wave of traumatization. This caused a huge outcry among the journalists. Why give so much detail? I'm giving masterclasses to psychologists who work on the hotline at the moment. When I understand how vulnerable they are to what they hear, sexual abuse is like no other type of abuse, propagated and goes beyond just abuse. It goes to the domain of collective trauma. This wave is mounting. The effect is rippling. I believe this is an eternal topic. As long as humans exist, violence exists. There are so many things we'd have to process in the future, and we'd have to work with the framework of the society. I could go on and on, but I'm feeling like I'm the lecturer here, so I'll stop at this point. Thank you.
Thank you. Hvala. Hvala lijepo. Thank you. Yeah, true. I had a presentation before about what we do in the Netherlands when the rape is very recent, like yesterday, and what would that mean in war rape situations. But I understood that you had a presentation before about acute sexual abuse, but it is a societal problem, and we all need to. So all the monkeys. The reason why I showed you the 3 monkeys, because the monkey on the left side is in a way responsible. He and she can make a difference. So we really need to take off the hands and confront ourselves with the reality. And there's so much information to be given Also to the monkey on the left side. I saw that someone was asking, why do perpetrators do this? Why? And how can we help them? Well, perpetrators do it because of the sexual arousal in the first place. They feel it and they want it. But there are various types of perpetrators. Some people are antisocial behavior. They steal, they drive too fast, and they also they rape when they want to. Some people only do it under influence of alcohol or drugs. Some people do it for money. Some people are addicted to sex. Some people are addicted to attention. Some people are pedosexuals. But you do have to understand that the majority of people who abuse children are heterosexual. They are not pedosexual. So this, and how do we treat them? Well, I think what most perpetrators have in common with each other is not that they have been abused themselves as a child, but that they have had neglect, emotional neglect as a child, and they have low self-esteem. Now, in the Netherlands, when a case of sexual abuse comes in the media, the whole society says the perpetrator is a bad person. We don't want him out. Kill him. Well, not really kill him, but we don't want you. And I think that is not helping. Yes, we have to say your behavior is wrong. It's a crime. But you as a person, keep the person intact. Because if you tell, it's not only your behavior, but you as a person have no value and we don't want you, then in a way you will activate the low self-esteem. And what do people do when their low self-esteem is activated? Yes, they do bad things or they hide even more. So what we know from research, what does help in a way, and I know it does sound against your nature, but making this perpetrator have the feeling, I am part of a group, the sense of belonging, I have value, I am part of a community, I am needed, helps against criminal behavior.
Thanks for adding that perspective, Iva. That's very helpful and very thoughtful also. And thanks, Oleg, for doing it again, the question, because now we have a translation to Iva. That's appreciated. No, thanks again for a passionate presentation. You'll stay with us, and you'll be able to, since you now are on the translation mode, you can listen to Marta. and Iryna, would you invite Marta to share with us the clinical arm of this?
Так, дійсно, я думаю, що дуже важливо почути українську.
Yes, indeed. I think we do need to hear the Ukrainian specifics of what are the specifics in the work of the victims of sexual violence. So I invite Marta Chumalo, who is the head of the Women's Perspectives Center, and they have tremendous experience. She is a feminist, a gender expert, a psychologist, and she has huge experience of providing care in the organization. So not as an individual practitioner, but in the organization. So Marta, also if you could respond to a few questions which we saw in the chat in Ukrainian, like on why me, for example. This is a question that the victims might ask. What do you respond to this? Thank you. Thank you, Iryna. It's a pleasure to speak at this esteemed forum. Can you see my slides on the screen? We can. Perfect. So I do have experience, but I will talk about it later. First, I wanted to say that I have focused on a very relevant subject, uh, as already mentioned by Oleg. This is conflict-related sexual violence, and I will use the abbreviation for this, CRSV. So I will talk about victims of CRSV. This acronym is getting traction in Ukraine, so it's used widely. So briefly, indeed, I've been working in the center called Women's Perspectives, and I have practical experience. I work in EMDR, in CPT, and schema therapy, and we provide assistance to the victims of um, domestic violence, sexual abuse. That includes both children and adults. And we work not only by providing services directly, but also we help with advocacy. We want to change the situation. We want the society to be more sensitive to the needs of the victims. And often we also um, do trainings for those who work with the victims to improve the quality of the services. So today I decided to start with this slide. Usually it's the last slide in my deck when I train different service providers, psychologists, psychotherapists, people who contact with the victims of sexual violence and CRSV. This slide shows the logic of the interventions which we can provide, the interventions which are needed. So this is the logic of the protocol in a stress and trauma sensitive approach. So the first main sphere of interventions is talking about the present, talking about now. I always reiterate, if service providers do not have special knowledge or tool set in psychotherapy, in different interventions, then the sphere of influence they have is this first aspect. It's stabilization. And already it helps a lot. It helps a lot to the victims who suffer. So the first thing, the first major block is working with the present, working with what's now, when we help uh, the victims to feel safe, and we try to uh, help them restore their habits, their routines, self-care, when they start doing things they had been doing before the trauma. And we try to do all these aspects in parallel. We also help them. We help give skills to restore resources. We work with the victims to try and see which practices they can use to help themselves. Psychohygiene, and it takes a lot of education to show how people can help themselves. Also, if there are issues which have come up, if there are some other comorbidities, then of course we can help the victims with that. And another important dimension, it's we need to help victims get out of the isolation. And of course, we do trauma processing if it's possible. So this other block, it's essentially the processing of trauma when we deal with the past. It depends on the techniques available at the provider. And I understand that different directions in psychology have different approaches and different tool sets to helping the victims. And it depends on whether it was a monotrauma or PTSD, if it has developed. And the third block is about the future, when we help grieving, when and the question you've mentioned, why me? Why has it happened to me? When I hear this, I always respond, well, indeed, you were unlucky. It could have happened to any other person. So I use this paradigm to communicate. I think it helps because we start deploying the future. We start unfolding the future. It's the new beginning. As soon as the person has the skills to provide self-care, they are in this window of tolerance, they can start a new life. And I also have a few slides. It was really great to hear from Iva. The terms they use. We have several Ukrainian words for victim, and one of these words, жертва, is used only for those who have died already. So those who cannot fight back at all, those who cannot cope because this person is dead. For them, we use the term жертва as the victim. And we use other terms such as sufferer or the survivor for those who still can do something. So we really have to watch our language, our terminology, because it matters a lot. When we communicate, we can use these terms. And for example, we do not use the expression she subdued to violence, because this makes the victim powerless. And also we don't use, of course, the word the victim provoked the violence, because, well, that's victim blaming and that's no good. So we do use other terms. Instead of the victim, most probably we use the term which in Ukrainian is about the sufferer, or there is also a legal term for that, but there is a best term for this, which is more or less equivalent to the English survivor. This is Ukrainian "вціліла," which means still is wholesome. So this term, when we use it, "вціліла," or the survivor, we show that the person had this experience, but the person still is wholesome. And also, there is another important chain of notions, and I would like to focus on this. And it's great that both Eva and Ulrike have already focused on this matter. This is the unfolding of the dynamics. Very often we see this victim blaming. What happens with CRSV, as Oleg already has remembered, that is the wide response in the society. In social media, there are many questions to the victims, and the victims and their comments to the media. They hear this often. Oh, everybody evacuated. Why haven't you evacuated? Why didn't you take this train? Why didn't you stay in the shelter? Why did you get out of that basement? I mean, there are signals which essentially signal guilt. And this is what victim blaming is about. So in this case, the survivor realizes that, well, maybe it was her fault, maybe she did something wrong. That's no good. So this victim blaming, when we have the question why this victim blaming is happening, I think it's because the society wants to create a distance with the experience of the victims. We want to prove ourselves. Well, uh, my psyche is about my behavior, and I don't want this to ever happen to me. So I would never do what she did. So it would never happen to me. So this victim blaming, very, very often in these subliminal messages, uh, it's just it just burdens the survivors. And we have this chain of guilt or blame. Then we have shame. Shame is this very social emotion. When we make it clear for the survivor that there's something wrong with the survivor, it's the attack on the personality, on the identity. Something's wrong with that with that personality. Or if I feel shame, this is essentially the emotion of something wrong with my identity. We feel this when the borders are violated, when we have some hierarchical relationship. So when we talk about CRSV, it's very important to realize that rape related to conflicts, this is a way to um, denigrate the opponent, the adversary. And the men who raped women in in Ukraine, in the occupied territories, I I wouldn't say that they all had been emotionally neglected. It was a coordinated strategy. It was part of the order. It was part of the general strategy to humiliate the enemy, to dehumanize the enemy. This is a tool of war that they have used. So CRSV is slightly different as a crime than, um, let's say, domestic sexual violence towards women and children in times of peace. In times of war, it's slightly different. But anyway, we have the guilt and the shame and isolation. And when we look at what happens with the victims in Ukraine, we can easily see that women stay silent. They don't get help. They don't seek medical assistance, or they are seeking care anonymously. And unfortunately, for a few months, we see that there really is lots of pressure on the victims. There are many documenters who pressure victims into testifying, but this just re-traumatizes them. And their experience, of course, it is an important evidence in crimes against Ukraine, but it is also about their personal experience. And their condition is often overlooked. So I wanted to say that what we experience now, what we all live through, is a new experience, not only for Ukraine, but also it's a new experience for the world to some extent, because the processes go differently. For example, when the crimes are documented almost in real time, I hope coming through this experience, our country and the law enforcement agencies in Ukraine will start looking at it differently. They will start being sensitive to the victims, and they will start respecting the victims more, because we see that this sensitivity to the victims of CRSV, it's higher than sensitivity to victims of sexual violence in times of peace. So what we see now, both in the society overall and with the law enforcement and the documenters, they have more respect and more sensitivity to the experience of the victims. So I hope this experience will later spread to the victims of domestic sexual violence, and it will help us all be more sensitive. Thank you for this opportunity to share my experience, and if there are any questions, I'm happy to respond.
Thank you, Marta, for that overview from a clinical arm. Iryna, do you want to review or say a few things before we actually before I would like to give the word to Iva again to maybe have some reflections on what you heard presenting from Marta? Iryna, any comments from your end before we go there?
Дякую, Марто. Я думаю, що
Marta, thank you.
стислий час ви змогли
In a very short period of time, you have managed to make expert conclusions with a long track record of working with the subject. I believe this meeting is first and foremost an opportunity to build bridges between the women who need the help of your center, between the psychologists who see those clients in working with your experience, and between the Ukrainian experience and the Dutch experience and European experience overall. I believe this was one of the tasks we had. Thank you.
Yeah, thanks. Thanks for saying that. We have, dear attendees, about 5 or so minutes before we wrap it up, but I would like to give the word to Iva to reflect from her expertise to the talk that you just gave, Marta. Iva, may I invite you to give some reflection?
Thank you very much, and thank you very much, Marta. And also very nice to listen to you. And I was really struck to hear that victim blaming even happens in wartime. I couldn't believe it, that you would think that it in a way softens the human being, but still so harsh, and the victim blaming goes on even in war conditions. I was also wondering, do you also see boys and men, the male victims, because what I understood also from you, that the difference between war rape and, let's say, normal sexual abuse or sexual abuse in peace conditions is that the war rape is often meant to be seen. It is meant to be discovered. It is meant to have witnesses in comparison to sexual abuse in
That's a great
peacetime.
question. Yeah.
Yes. And I was also wondering, do you see male I loved your what you said about the word victim, or the different words that you use. Thank you, very inspiring. But do you also see boys and men? As you are a women's center, where do they go?
Так, ми маємо кілька звернень.
Yes. Oh, some boys have seen us. They are,
Я думаю, що це пов'язано з
well,
війною.
I think it's related to war, but it's an internally displaced child, abused by his coach. But talking about men, based on what is described, we can conclude that these cases do happen under the same logic.
Yes.
So usually sexual abuse relates, conflict relates to sexual violence. So it's about having, and sexual violence in general is about having control. It's about humiliating and denigrating, that we are humiliating your women, your men, that we dominate symbolically.
Yeah. Thank you. Yeah, it's very different, I think, also compared to sexual abuse in civilian times, or this dynamic and the motivation to do it. Thank you, Marta.
So thanks again, and we appreciate your presence again, Oleg. And this was not rehearsed, so I'm putting you on the spot again. But I hope you don't mind me asking you again to reflect some of on what you've just heard from Marta.
Дякую, Ерік. Ну, мені
Thank you, Eric. I liked it, Marta. Well done. You know, you can feel that you're absolutely passionate about it. And the situation is changing. Recently, I saw this piece of work. It's unrelated to sexual violence, but let us draw some parallel. It was about gendered perception by the doctor of their patient, about the stereotypes that the doctor had, that the patient is likely to be a man because he has a metabolic syndrome, smoking risks, etc., etc. Whereas a woman, it's not really perceived as a patient. It turned out that female doctors have more understanding of the victims, the patients, women patients. So it's not about sexual violence. We have so many stereotypes regarding sexual violence, loads of them. And it's a much more complicated domain. Iryna might remember it. Before the war, we cooperated with UNESCO. We assisted the victims who were trafficked through Ukraine to Europe. They were coming from Africa and Asia, and we worked with boys victims of sexual abuse. It's a lot harder. So if it's the abuser is the peacekeeper in Africa, the family is grateful to the peacekeepers, and therefore they sacrifice their kid to the peacekeeper, allowing the peacekeeper to become the abused. That's so complicated. Ambivalence. But it's the total split of the child. Iva brought the concept that was so apt, so true. You need to build from the positive only. We held our own webinar today, and it was said there, it's not the hate or the rage that can win the war. It's the love that wins the war, the love towards one's land, because the hate will only drain you, and love makes you more resilient. Therefore, working with these patients is extremely difficult, but the society is much more open to that. And what we're seeing in Ukraine is this case of society opening up when we openly share about it, where we raise these questions. What else can we do to make a difference, all of us?
Thank you, Oleg. Thank you for saying that.